Hi, my name is Ryan, student at Nightingale College. Today we'll perform the task of NG tube insertion on a patient. First thing we do is check the provider's orders and make sure we got all our supplies. We're going to have our suction canister with the tubing. We're going to have gloves. We've got our specimen cup and pH strip. We've got water for the patient to drink. We've got our NG tube and a basin. We've got our absorption pad, tissues. We've got our 60 cc syringe, pen light, we've got stethoscope, towel, another basin just for supplies, our lubricant, we've got the our safety pin and tape. All right, so after we've gathered our supplies, we'll knock on the door, enter and close the door behind us for patient privacy, do hand hygiene and put on our gloves. Introduce ourselves to the patient. Hi, my name is Ryan. I'll be your nurse today. Today, the doctor's ordered an NG tube, and we're going to be suctioning out some stomach contents because you have a blockage. Okay, and I'll check their ID and verifying two patient identifiers. What's your first and last name and date of birth? And then I'll check the wristband. All right. After I'll lay all my supplies down on a clean surface, and I'll get everything set up. I'm going to put the absorbent pad on their chest. I'm going to look at the patient's nares, decide which nostril I'm going to go into. I'm going to look left, right, I'm looking for deformities, contusions, abrasions, make sure the septum's midline. I'm going to have them plug, and both the nostrils look good, so I'm going to have the patient plug each nostril at a time and breathe in and out through the opposite one. After doing both of them, looks like the right nostril is going to be the best one. I will then measure the patient with the NG tube to where the marker is going to be. So from the tip of the NG tube, I'm holding the tip of the nose and go to their earlobe. And then from the earlobe, we go down to the xiphoid process. And we're at about 50 centimeters. So 50 centimeters is going to be our marker. I'm then going to put the NG tube in a basin with warm water to make it a little bit more malleable. I'm going to get our lube ready, open up the lube, and put in the other little basin here. And then I'm going to lube up the tip of the NG tube. Have the patient, I would want to make sure the patient's at a elevated position for me and high Fowlers. Now the high Fowlers, I'd have them tilt their head back. And all right, bud, you can feel some pressure. It's gonna go up the nose, the right nostril. I'm gonna start going back. If there's any kind of, if it's not gonna move at all, I'm gonna stop and I'm going to bring it back out and start in the other nostril. But we're looking good so far. I'm gonna keep advancing. As soon as we get to the oral pharynx, the patient might start to gag. If they start to gag, I'm gonna pause, have them take a few breaths, and we're gonna drink some water. I'm gonna tilt their chin to their chest, their chin down, and I'm gonna start with every sip and swallow. I'm gonna advance 2 to 4 inches. Another sip, and then we're gonna keep going until we get to the 50 centimeter mark. Looking good. All right, patient's tolerating it well. We're now at 50 centimeters. I'm gonna hold that. I'm going to then tape the NG tube to their nose just temporarily so the NG tube stays in place. We'd verify placement depending on what the facility's protocol is. Just temporarily, we're gonna withdraw some stomach contents. So I'm gonna drop 30 cc's. It's 30. And I'm going to inject the 30 cc's of air. I'm going to inject 33 cc's of air into their stomach. And then I'm going to withdraw 10 cc's. I'll be clamping this in the meantime. Put that into our specimen cup and take our pH strip. Drop it into the pH strip. And we're going to want to hopefully read a pH of 2. I'm going to then clamp this as we're losing our tape. We want to make sure we're still at the 50 centimeters. We're going to secure this to the nostril and their septum. I'm going to split it down the middle. Remove this one, make sure we're still at 50 cc's, which we are. This one's going to go on the bridge of the nose. And we'll secure the other one. We're going to wrap around the NG tube. The other one's going to wrap the opposite way around the NG tube, just to help us secure it. Make sure it's secured onto their septum. We're going to use the bobby pin to secure this to their gown. We're still plugged because we don't have some tape. We still have verification with the x-ray. We would call x-ray, have x-ray come down, verify placement. We remove this. This will be on their gown. And I'd be hooking this up to their gown with the safety pin. After x-rays come and confirm placement, we would then hook them up to the suction. So hook up the suction here. We'd make sure the patient's comfortable. We'd be looking at what the color and the stomach contents are. We would document what we'd leave the room. We'd take off our gloves, clean up our mess, perform hand hygiene. We lower their bed into a comfortable position. We would document our care, our procedure we've done, how much we pulled off the stomach contents, what it looks like, and how patient tolerated it. And voila, we have done NG tube insertion on patient.